Hello, and welcome to ALSpathways.ca expert video series. My name is Dr. Wendy Johnston, and I am the ALS Clinic Medical Director for the University of Alberta ALS Clinic and the K Edmonton Clinic in Edmonton, Canada. In this video, I hope to demonstrate the benefits of early referral to a multidisciplinary ALS clinic for suspected ALS patients. ALS clinics are multidisciplinary clinics, which bring together the health professionals needed to provide the best of care and the most up-to-date care for people with ALS, and also to support their families. Across Canada, there's a network of ALS clinics that are mostly in academic centres, although there are some community-based ones. The Canadian ALS Research Network is the name of the organization that brings us together so that we keep informing each other to provide the most up-to-date care. ALS clinics offer many benefits to patients with ALS and their families. First and foremost, the ALS expert at the clinic, usually a neurologist or physiatrist, will confirm the diagnosis. Often patients and families don't necessarily believe the diagnosis until they've seen and had the diagnosis confirmed by an ALS expert. Once confirmed in the diagnosis, the patients are enrolled in a multidisciplinary clinic. The benefits of the multidisciplinary care clinic are myriad. First of all, enrollment and participation in a multidisciplinary clinic has been shown to increase longevity. It has a positive impact on prognosis. Patients with ALS who are participating in multidisciplinary clinics have fewer and shorter hospital admissions and are more likely to be prescribed and use adaptive equipment. Their quality of life and the family support is improved compared with the practice of caring for patients in a general neurology office. Additionally, most CAL centers offer access to clinical trials and other research. We know that patients with ALS value participating in research and contributing not only to their own care, but to the future care of people with ALS. Finally, ALS clinics coordinate with the providers in the home community and provide their expert advice to those who will be caring for patients in their home and in their home community. A multidisciplinary clinic typically offers the services of specialized physicians and experienced and specialized allied health professionals to provide expert care and management of the different components of ALS and how they affect people. So a typical clinic will have a neurologist or physiatrist as a lead, and access to rehabilitation therapists, which include the physiatrist or rehab doc, as well as physical and occupational therapists and speech-language pathologists. Typically, a dietitian also supports the clinic. Another important aspect of care is respiratory care. Respiratory care is advantageous in the clinic because the testing is done with respiratory therapists who are experienced in doing tests with people with ALS. Additionally, the interpretation by the respiratory doctor is important for advice on when to initiate supportive therapies and how to manage them once they've been initiated. Such therapies could include lung volume recruitment, which is a low-tech way to support respiratory function, as well as non-invasive ventilation when respiratory muscles get weaker. Speech-language pathology is really important in the care of people with ALS. There are two main aspects of speech-language pathology. One is speech, that is communication, and the other is swallowing. So often SLPs, as they're called, will be monitoring both. SLPs in multidisciplinary clinics in the CALS network will offer such things as voice banking, since many people with ALS will eventually have their voice be affected in some way. Voice banking allows for the natural voice to be kept and used if assistive devices are using computer-generated speech. Swallowing is very important. Life life-threatening episodes of aspiration or choking need to be anticipated and prevented. In fact, choking to death is one of the big fears of people with ALS, and having a speech-language pathologist provide expert advice around how to manage swallowing changes as they occur and when to offer alternatives to oral intake. Likewise, a dietitian is very important. Studies have shown that weight loss is associated with a poorer outcome in people with ALS. So the combined dietary and speech-language pathology advice is very important for maintenance of weight. Many clinics coordinate with palliative care. People with ALS will typically develop symptoms that require support on a more day-to-day basis, and coordinating with both expert palliative care physicians and palliative care in the community is very important for people in the final stages of ALS. Most clinics in the CALS network have research coordinators attend the clinic. If a patient agrees or expresses interest in research, the clinical team will invite the research coordinator to meet with the patient and family to describe the opportunities for participation in research at that site. While the clinicians may give the overview of all the clinical research available, the coordinators get down to the nitty-gritty and provide the roadmap for patients who are interested. Research coordinators can enroll patients in a database that will allow the patient and family to be updated for any research opportunities that arise subsequent or in between clinic visits. This team would fall apart if we didn't have a strong leader in our nurse coordinator. Each ALS clinic has a coordinator, usually a nurse, who oversees and brings together for the final discussion with the patient about what the goals of that particular clinic visit have been and what the plan is for the weeks and months to come. Additionally, most clinics have access to social work, whether by referral or within the clinic. Social workers are tremendously important both for patient and family support, providing counseling around changes in life, also for potential referral to psychosocial resources. Social workers also help navigate the difficult transition to disability payment and help with all the forms that insurance companies demand. Without these two key components, our clinic teams really wouldn't be able to pull together. People with ALS experience changes throughout the course of ALS. They experience changes in their ability to communicate, to get enough nutrition in. They experience mobility changes. They experience changes in their respiratory function. The ALS multidisciplinary clinic anticipates these and educates the patients and their families around the interventions that can make a difference and provides the appropriate prescriptions and at times the actual equipment. ALS clinics across Canada also coordinate with their local ALS Society. The ALS Society has a huge role in supporting people with ALS throughout the course of their illness, from diagnosis until end of life. The ALS Societies provide equipment as well as support in the form of home visits and community support to patients in their home communities. Currently, we've been experiencing a lot of changes to care delivery because of the COVID pandemic. Both the clinics and the ALS Society have pivoted to providing more virtual support while also anticipating the actual face-to-face needs of people with ALS. All the clinics have been providing remote or virtual visits, as well as coordinating more closely with the home providers as well as the community-based physicians. The ALS clinics feel that early diagnosis is very important and referral as soon as possible will enhance the quality of life of people with ALS. Typically, patients with ALS wait long periods before they are referred to an ALS center. The time to arrival in an ALS clinic has been reported to be 21 months on average after onset of symptoms. With a disease where the median survival is 3 years or 36 months, this leaves barely more than a year to accommodate the diagnosis, get all the supports in place that will allow adaptations to continue activities of daily living. It provides very little time for patients to get the standard of care therapies. There's been a tendency for those responsible for making the diagnosis of ALS in the community, neurologists and physiatrists in particular, to wait until they're absolutely sure of the diagnosis before making a referral. This sense of responsibility is important, and I respect that. But these days, patients themselves may be making the diagnosis. They may be suspicious of the diagnosis, even if they don't bring it up with you. When there's a suspicious set of symptoms and you're wondering about ALS, that is the ideal time to make the referral. ALS patients would benefit from early referral, even before all the confirmatory tests have been undertaken. Typically, multidisciplinary clinics are situated in tertiary care centers where it may be possible to expedite some of the investigations, particularly imaging such as MRI. Rather than waiting for all the test results to come back and being sure of the diagnosis, early referral can allow patients to have early access to supportive therapies. As described, the multidisciplinary clinic provides supportive care in so many areas, and waiting till the diagnosis is absolutely sure can result in patients coming to clinic with immediate and urgent needs for respiratory and nutritional support. Patients will arrive in clinic with no ability for us to provide interventions such as participation in clinical trials or even the standard of care, which have requirements to have a minimal forced vital capacity, for example, on the pulmonary function tests. In certain clinical contexts, an experienced neurologist or physiatrist will wonder about ALS. When a patient has progressive motor decline without obvious other neurologic symptoms, when patients have changes in their speech and swallowing, as well as behavior changes, when a weak limb gets progressively weaker. In these contexts, the confirmatory tests that you want to do could take weeks or months to arrange. The ALS diagnosis by the international criteria were actually set up to be made clinically. The findings of progressive weakness and wasting, fasciculations, increased tone, or a frank spasticity in any part of the body, whether it's the lower extremities, the arms, or the bulbar territory, are instantly suspicious for ALS. Combinations of signs, including changes in speech or swallowing with a weak hand, are also very suspicious for ALS. Imparting the diagnosis of ALS is one of the most difficult conversations that a neurologist or physiatrist or other clinician can have with a patient and family. There are a lot of guidelines around for delivering bad news, and the setting, the opportunity to have a family member with the patient, these are important aspects. But what information are you wanting to share, and how can you be honest, but also honest about some of the uncertainties? Since we're asking for patients to be referred as early as possible, you may be in the position of referring at a time when you yourself are not certain, but you're just suspicious. I think it's fair to say that if you share that you're concerned, if you share that you have suspicions that this is a serious diagnosis, and if you're comfortable to say you're concerned it's ALS, then you can accompany that by the promise that investigations are ongoing, that the early referral is important, so if the diagnosis is confirmed, that the patient gets the most advanced therapy and access to the most expert opinions available. I don't think you need to feel it is incumbent upon you to explain everything and go through all the potential outcomes. squarely placing the patient in the position that you have a condition that we must take seriously, that we need to get the most expert people involved to care for you, that you have to have the most expert and advanced care available, including potentially new therapies, puts it in a hopeful context while also emphasizing that the condition is serious and needs to be acted upon quickly. ALS clinics are present across Canada. Each province has at least one, if not more. The territories have fewer patients with ALS, and they're cared for in an adjacent province. There are 18 clinics across Canada based in academic centres, and there are emerging multidisciplinary clinics in community-based centres. The ALS Canada website has the contact information for all the ALS clinics in Canada. ALS care is really evolving, and it's evolving quickly. There are more therapies available now and potential therapies being tested than ever before. I look back on the last 20 to 25 years in the evolution of care of people with multiple sclerosis, and I believe we're on the verge of the similar revolution of care of people with ALS as multiple therapies become available, and these disease-modifying therapies will need careful curation to see that which ones are right for which patients. The time is now to start earlier diagnosis. Previously, we've been a bit protective, even paternalistic towards patients with ALS, only telling them when we were absolutely sure. The feedback from people with ALS is that they want to know when we suspect. They want to be prepared. They want to be participating in their own care and making decisions about how they're going to spend their time, how they're contributing back to diagnostic and to therapeutic certainty. So now's the time to start making the diagnosis earlier, to get people into the multidisciplinary clinics where we're hopeful of having very significant therapies to alter the course of ALS. I know that cure is always the goal, and who knows, that may be possible, but we can change the course of ALS, and if we get started earlier, we have a better chance to do so. If you're looking for more information, I suggest looking at alspathways.ca/HCP. Once again, my name is Dr. Wendy Johnston, and this has been an alspathways.ca expert video. Thank you for watching.